Hello, my name is Kevin Corcoran. I'm president of Corcoran Consulting Group. Today we're going to discuss ICD-10 fundamentals, and I'll be presenting it in two parts. This is part one. ICD-10 is important to ophthalmologists and optometrists because the proper diagnosis code is an essential element of claims for reimbursement, and ICD-10 takes the place of ICD-9 for most payers. At the outset, we should understand that there are two versions of ICD-10. The older progenitor version, published by the World Health Organization, used by coroners throughout the world, including the United States, to classify cause of death, and the US-centric version, known as Clinical Modification, or ICD-10-CM, published by the United States government's National Center for Health Statistics to classify and code morbidity. They are comparable. The term clinical is used to emphasize the modification's intent, to serve as a useful tool in the area of classification of morbidity data for indexing of health records, medical care review, and ambulatory and other healthcare programs, as well as for basic health statistics. To describe the clinical picture of the patient, the codes must be more precise than those needed only for statistical groupings and trend analysis. ICD-10-CM far exceeds its predecessors in the number of concepts and codes provided. The disease classification has been expanded to include health-related conditions and to provide greater specificity at the 6th and 7th character level. When the instructions call for 6th and 7th characters, they are not optional and are intended for use in recording the information documented in the clinical record. As a consequence, ICD-10-CM provides better data to measure care, process claims, track public health, identify fraud and abuse, and conduct research. In the balance of this presentation, we'll refer to ICD-10-CM by the shorter term, ICD-10, for the sake of speed. However, you should understand that we're only discussing the clinical modification version. Why replace ICD-9? ICD 9th edition, the predicate to ICD-10, is 30 years old, outdated, and includes many imprecise or obsolete terms, as well as inconsistencies with current medical practice. As a result, ICD-9 provides only limited data and produces many inaccuracies in healthcare statistics. The current system is no longer adequate. Change is long past due. The federal government and third-party payers expect that ICD-10 will provide many benefits for the U.S. healthcare system. These include more accurate payments for new procedures, fewer rejected claims, fewer improper claims, better understanding of new procedures, improved disease management. ICD-10 contains 4 more chapters than ICD-9 and about 5 times as many codes. The codes are longer, 3 to 7 digits instead of 3 to 5 digits. And the characters and numbers within the codes are organized differently. Here is an example of how the two coding systems differ. Within ICD-9, there's a single code to describe central corneal ulcer, 370.03. Within ICD-10, there are 4 codes, one for the right eye, one for the left eye, one for both eyes, and one where the chart note does not specify which eye. Implementation of ICD-10 has been in the works since the final rule for adoption was published in January 2009. Initially, implementation was scheduled for October 1st, 2013, but the American Medical Association and other medical societies requested postponement. CMS agreed to a 1-year delay, and further postponements are very unlikely. CMS stated, "We believe that 1-year extension through September 30th, 2014 offers physicians adequate time to train their coders, complete system changeovers, and conduct testing. It's hard to understate the impact of ICD-10. Everything changes. Physicians are impacted by the need to document better and choose the right codes. Administrators must oversee implementation and education about ICD-10. Coders and billers will need better appreciation for medical terminology, and payer policies will all change. Technicians will need to document more, particularly in the medical history. New forms will be required. For example, your current super bill will change drastically. At the reception desk, prior authorization will also use ICD-10. Your information technology staff must update computers for ICD-10, and billing companies, just like coders, must learn the new coding system. Beginning in April 2014, CMS expects Medicare contractors to start issuing new coverage and payment policies with ICD-10 codes as part of those new policies. Pre-authorizations by most third-party payers will require ICD-10 codes. PQRS's rules will be updated too. If you use diagnosis codes to help track patients, then ICD-10 will feature prominently in that process. For marketing purposes, many practices use diagnosis codes to find patients in their database. Any form with a diagnosis code on it will change. To get claims paid, practice management systems will need to support both ICD-10 and ICD-9, since some payers, such as workers' comp, won't make the switch. While the content of the ICD-10 code set is very different from ICD-9, it's organized along the same lines. The handbook includes an introduction, conventions and guidelines, an alphabetic index to diseases, a neoplasm table, a table of drugs and chemicals, an index to external causes, and finally, a tabular list of diseases. There are two large sections within the ICD-10 handbook. The alphabetic index includes the index of diseases and injury, index of external causes of injury, a table of neoplasms, and finally a table of drugs and chemicals. The other large section is the tabular index with categories, subcategories, and codes. It's important to understand that the alphabetic index is a good starting point, but you must always confirm the code selection in the tabular list due to the additional instructions only found there. The alphabetic index is a list of terms in alphabetical order and their corresponding codes along with notes that provide direction and instruction. The tabular list provides all of the ICD-10 codes in numeric order according to body system or condition. The first three characters in the ICD-10 code constitute the category, while the fourth, fifth, and sixth character provide additional specificity. The fourth character further defines site, etiology, manifestation, or state of disease or condition. The seventh character, although not universally applicable, provides additional information. It is most commonly found in Chapter 19, which describes injuries. Interestingly, when a seventh character is needed, but the root code only contains 5 characters, then a placeholder is inserted for the 6th digit. The placeholder is an X and can be capitalized or not as you wish. Instructions for the 7th character appear in the tabular list, not the alphabetic index. One example is the encounter type, initial, subsequent, or sequelae. The letters A, D, and S are used as the 7th character to provide this information. An initial encounter takes place the first time the physician sees the patient for that condition. A subsequent encounter occurs when the physician sees the patient again for the same condition. A sequelae is a late effect, such as a complication, which may occur at any time after the condition is seen. Now let's see how the seventh character is applied in a case involving a corneal abrasion due to a sports injury. Start with S05, injury of eye and orbit. Once we find injury of conjunctiva and corneal abrasion without foreign body, we see 5 character codes that can assign laterality for the side of the body. In this case, the right eye, S0501. Now we note at the top of the section of the tabular list an instruction that says the appropriate seventh character is to be added to each code from category S05. Our choices are A, initial encounter, D, subsequent encounter, and S, sequelae. We choose A, initial encounter, but we need to use the X placeholder as well, since S05.01 is only 5 characters long. Our final code is S05.01XA. Another use of the seventh character extension is for glaucoma staging. 0 signifies unspecified. The glaucoma stage is not noted in the chart. 1 signifies mild. 2 signifies moderate. 3 signifies severe. 4 signifies indeterminate, which means that the physician doesn't know the glaucoma stage, possibly because the patient cannot follow instructions for the perimetry test. The glaucoma staging rules remain the same as in ICD-9 to describe mild, moderate, and severe. However, ICD-10 stipulates glaucoma staging by eye and doesn't follow the concept of code worst eye used in ICD-9 since October 1st, 2011. Here's an example of glaucoma staging using the seventh character extension. We start with low tension glaucoma, H40.12. Then we note that it is bilateral, and the root code becomes H40.123. Recall that 3 means bilateral. But we can't stop here because we are instructed in the tabular list to add a seventh character to designate the stage of glaucoma. For the right eye, it is moderate, so our final code is H40.1212. For the left eye, it's severe, so our final code is H40.1223. We'll need to use both codes on the claim form. Note that we didn't need a placeholder in this case because the root code is already 6 characters long. One of the most important new concepts in ICD-10 is laterality, and this concept accounts for most of the increase in the number of codes. Laterality refers to the side of the body, right, left, or both. Most, but not all ICD-10 codes use this concept. This is very important from a documentation standpoint. The chart note will need to stipulate laterality in the impression. 1 signifies right, 2 signifies left, 3 signifies bilateral, 0 and 9 don't specify laterality, it's unspecified in the chart notes. When we get to conditions of the eyelid, things get murky and confusing for the coding of laterality because of the additional upper and lower eyelids. Additional attention is certainly needed. In this example, H02.011 refers to the right upper eyelid. H02.012 refers to the right lower eyelid. H02.013 refers to the right eye, but doesn't specify which eyelid. H02.014 refers to the left upper eyelid. H02.015 refers to the left lower eyelid. H02.016 refers to the left eye, but does not specify which eyelid. H02.019 doesn't specify the eye or the eyelid. You can see that oculoplastics is more involved where laterality is concerned. Combination codes are another new concept in ICD-10. A single code incorporates two diagnoses. Within ICD-9, two diagnoses usually meant two codes. This has significant implications for documentation in the medical record. The instructions within ICD-10 take up the first 80 pages of the handbook and are worth reading. They include guidelines, conventions, and terminology that are not always intuitive. Many of these provide direction and tell you where to go and what to code and what not to code. Instructional notations exist in both the alphabetic index and the tabular list. Code also instructs that two codes may be required to fully describe a condition. Sequencing depends on the severity of conditions and reason for the encounter. The chart note will need both conditions to make coding possible. C and C also are two more terms that provide coding instructions. C follows a main term in the index indicating that it is necessary to go to that term to locate the correct code. C also follows a main term in the index indicating that another term may also be useful. The instructions to code first and use additional code pertain to situations where two codes apply, one for the ocular manifestation and one for the underlying disease or condition that gave rise to it. For example, glaucoma and aniridia. Code first will list at the etiology code in the tabular list in parentheses. Use additional code will be listed at the manifestation code in the alphabetical index in brackets. The term excludes is used in two different ways within ICD-10 with very different results. Excludes 1 means these codes are mutually exclusive with all of the listed codes in that section of the tabular list. The excluded code should never be used at the same time as the listed code. Excludes 2 means not included here. Patients might have both conditions at the same time. Both codes may be used together on the same claim if the conditions coexist. In this case, chalazion and infected meibomian gland might occur together but don't have to. When the term "and" is used in a narrative statement, it represents "and" or. So burn of the cornea and conjunctival sac can also be read as burn of cornea or conjunctival sac. NEC stands for Not Elsewhere Classifiable. It applies when the information in the medical record is specific, but the level of detail does not exist in the code set. NOS stands for Not Otherwise Specified. It applies when the information in the medical record is ambiguous or incomplete, such that a more specific code within the code set cannot be assigned. NOS appears along with the term unspecified in ICD-10. In addition to the guidelines, conventions, and specialized terminology within ICD-10, punctuation also plays an important role. Brackets are used for synonyms, alternative wording, or explanatory phrases. Parentheses are used for non-essential modifiers, supplementary words that may or may not be present in the statement of a disease or procedure without affecting the code number assignment. Colons are used after an incomplete term that requires the modifiers following the colon to make an assignment. Similar to punctuation, the typeface has a purpose and implications for code selection. Boldfaced is used for the main term in the alphabetic index and for codes and descriptions in the tabular list. Italicized words and phrases are used with exclusion notes and manifestations. Now let's take a few seconds to check your comprehension of the key points in this program. You can skip the following few questions if you're in a hurry, but come back later on and try them. Why is it necessary to replace ICD-9 with ICD-10? A. Inconsistent with current medical practice. B. Does not provide enough detail. C. Outdated codes producing inaccurate and limited data. D. ICD-9 is 30 years old, outdated, and uses obsolete terminology. E. All of the above. The correct answer is E. All of the above. ICD-10 codes contain which characteristic not contained in the ICD-9 code set? A. The first digit is a letter. B. Codes may be up to 7 digits. C. The second digit is numeric. D. All of the above. The correct answer is B. Codes may be up to 7 digits. The left side of the body is most often associated with which number in the ICD-10 coding system? A. 1, B. 2, C. 3, D. 9. The correct answer is B. 2. If an ICD-10 code requires a 7th character but is only 5 digits in length, you should A. Place a 0 in the 6th spot. B. Do nothing. Use the code as it is. C. Place an X in the 6th spot. D. Use the appropriate 7th character twice. The correct answer is C. Place an X in the 6th spot. What is the proper coding convention in ICD-10 for an ophthalmic manifestation of an underlying causative disease? A. Etiology is always first, manifestation second. B. Manifestation is always first, etiology second. C. It doesn't matter which is first. D. It depends on handbook coding instructions. The correct answer is D. It depends on handbook coding instructions. ICD-10 states H27.0, aphakia, excludes 1, congenital absence of lens, Q12.3. The coder should understand that A. These codes are mutually exclusive. B. Both conditions may coexist. The correct answer is A. These codes are mutually exclusive. The ICD-10 states H35, other retinal disorders, excludes 2, diabetic retinal disorders, E08.311 through E08.359. The coder should understand that A. These codes are mutually exclusive. B. Both conditions may coexist. The correct answer is B. Both conditions may coexist. I hope you enjoyed this brief program and that you learned the fundamentals of ICD-10 coding. For further information, you may want to view another one of our e-learning programs on a related topic. If you have questions or concerns about this program, you may call us at 800-399-6565 or email us at our website. This program is a discussion of ICD-10 fundamentals and is not intended to be comprehensive in nature. You are encouraged to review official instructions by CMS. This program is not an official source nor a complete guide on reimbursement. The viewer is reminded that this information can and does change over time and may be incorrect at any time following its production. Thank you.